Hello, Ms. Smith. How are you doing today?
I'm fine, thank you.
Good, good. Well, welcome. As you know, we're here for your health-related fitness assessment, but before we do that, we need to do a pre-assessment screening for you to determine if there's any risks for you performing the exercise in this test. First, though, we need to sign this informed consent form right here. Let me explain what we'll be doing today first. We'll be doing a body fat percentage test by performing a skin fold test. That means we're going to be taking measurements by pinching your skin at different locations on your body. We'll also measure a few body girths with a tape measure to look at the distribution of fat on your body. After that, we're going to measure your cardiorespiratory fitness. We're going to have you exercising on a stationary cycle for 6 to 12 minutes, and we're going to monitor your heart rate and blood pressure in response to that exercise. Also, to determine your flexibility, we're going to do a sit and reach test. And that's going to measure the flexibility of your legs and back. And during that, we're going to measure how far you can reach to or beyond your toes while keeping your legs straight. And then last, we're going to look at your muscular fitness, and we're going to have you do a grip test with a dynamometer, and then a muscular endurance test where you have to do as many push-ups as you can in 60 seconds. So some of these things might be a little uncomfortable. You'll have to exert yourself in this exercise, but this assessment is definitely going to help determine your physical fitness level and ultimately improve your life. And all of your medical data will be handled confidentially, and you can withdraw your consent and stop the assessment at any time. So do you have any questions for me?
No, that sounds good.
All right, then if you just want to sign the informed consent form, and we can move on. Thank you. Okay, and then next, if you can look at the list you have there, the contraindications to exercise testing, and just let me know if you have any questions or have any of these. I know it's a very technical list, but I can explain any of them to you if you need me to.
Nope, it's not fine.
All right, great. Next, we're going to go through the health history questionnaire to determine if you have any risk factors that could prevent you from exercise testing. So, first off, what is your age?
I am 34 years young.
All right, very nice. And do you have any family history of heart attack, coronary revascularization, or sudden death?
Well, my father died suddenly at the age of 52 of a heart attack. We still don't know why. He exercised all the time and he was healthy. He didn't even take any medications or anything like that.
Oh, wow. Okay. Well, I'm sorry to hear about that. Do you smoke?
No.
And about how often do you exercise?
I try and get out at least once a week, but there's so many good shows on TV, it's hard to go outside, you know?
I hear you. It's tough. Are you taking any medications for hypertension or, in other words, high blood pressure?
Yes, my doctor has recently prescribed me some pills for my blood pressure. I guess he's been creeping up on me lately.
All right. Well, do you have any of the following? Any chest pain, dizziness, or shortness of breath?
Well, I do get really out of breath when I have to climb the stairs in my house, but
Okay. Do you have any other conditions that I would need to know about?
I did find out that I have a heart murmur a few years ago. That's
Heart
important.
Okay. Well, so you're looking at all this information from today. According to the ACSM risk classification categories, unfortunately, you are a high-risk individual. What this would mean is that we would need to consult with your medical doctor before we can do any assessments. So, unfortunately, we won't be able to do the assessment today.
Well, that's disappointing, but I do understand.
All right, no problem. And we'll talk with your doctor, and we'll get back. And I look forward to seeing you soon and getting you on the right track to good health.
Thanks.